My name is Joban Sehmi. I am a consultant cardiologist in West Hertfordshire, and today I'm going to talk about chest pain. Chest pain is a very concerning symptom and rightfully can cause significant anxiety. Often it doesn't indicate anything very serious, but at other occasions it can herald a significant problem. So, what is chest pain? Chest pain from the heart that is of concern is one that manifests as a tightness or heaviness in the center of the chest. It can sometimes be associated with breathlessness, can travel to the neck or left arm, and is brought on with activity. The technical word for this is angina, and it can indicate narrowings in the arteries of the heart. But there are many reasons why these symptoms may occur. My role as a cardiologist is to try and understand whether the chest pain is coming from the heart or whether there's another reason for this. So I would spend a good amount of time discussing your symptoms and looking at your past medical history and looking at patients' other family issues to try and risk stratify patients. The next stage, having taken a detailed history, would be to carry out tests to try and understand what are the underlying causes. I have an expertise in assessing patients with chest pain using non-invasive techniques. So this essentially means scanning the heart to try and understand what's going on. In patients who present with chest pain that comes on with exertion, the first line test would be a scan called a CT scan, which is a special type of X-ray, and this is done with dye being injected into a small vein in the arm, and we can directly visualize the blood vessels on the surface of the heart to look for narrowings and allow us to make a definitive diagnosis. In most patients, we identify either normal findings or minor narrowings in the arteries of the heart, which we can then treat with simple medication. If there are significant narrowings in the arteries of the heart, then further interventions may be required, including stent implantation and very rarely surgery. When assessing patients with chest pain who have narrowings in the arteries of their heart, a very important aspect is assessing lifestyle and addressing things such as levels of physical activity, weight, blood pressure, cholesterol levels. Should you develop chest pain, it's really important that you seek medical attention. In most cases, it's unlikely to be anything serious, but if a serious cause for chest pain is identified, it is eminently reversible and treatable.